HAS-BLED score. Okay, so this is for evaluating risk of bleeding in surgical patient. Okay, risk of bleeding in surgical patient. Okay, so the name itself has every component. So H for hypertension. Okay, and systolic BP more than 160 mm of Hg. Okay, A for abnormal renal and liver function. Okay, I will tell what is abnormal renal and liver function. Okay, and then S for stroke. Okay, then B for bleeding. Okay, then L for labile INR, E for elderly means more than 165. Okay, more than 65 years old. Okay, sorry. And then D for drugs or alcohol. Okay, and everything given 1 point. Okay, if there is two things like renal and liver, it will be given 1 or 2 depending on the patient to patient. Okay, so what is abnormal renal function? Okay, so chronic dialysis, renal transplant, or serum creatinine more than 200 micromole per liter. Okay, and what is abnormal liver function? Chronic hepatitis disease such as cirrhosis, bilirubin more than 2 times of upper limit of normal, aspartate aminotransferase and alanine aminotransferase more than 3 times of upper limit. Okay, history of stroke, sudden focal neurologic deficit from bleeding lasting for more than 24 hours. Okay, and diagnosed by neurologist. Okay, so bleeding lasting for more than 24 hours. Okay, and history of bleeding means bleeding that required hospitalization or causing more than 2 gram per liter drop in hematocrit or blood transfusion. Okay, and what is labile INR? That is therapeutic range less than 60%. Okay, in drugs and alcohol, like patient is taking antiplatelet, NSAID, and alcohol abuse. Okay, so remember HAS-BLED score. Okay, and based on this scoring, if the patient has a score of 1, it is low risk, 2 intermediate risk. Okay, and 3 or more than 3, it is a high risk. Okay, so remember HAS-BLED. H for hypertension, A for abnormal renal and liver function, S for stroke, B for bleeding, L for labile INR, E for elderly, that is more than 65 years of age, and D for drugs and alcohol. Okay, thank you.